Confidence is a skill that still needs development after pharmacy school. Even if you go on to do a residency or fellowship, there are still opportunities for you to continue to build your confidence. And one of the areas that I get told from students and residents and new practitioners all the time that they struggle with the most is their clinical confidence. They are not confident in the clinical knowledge that they have gained, or they feel like they need to learn more or build more knowledge in order to feel successful in the pharmacy field. So in today's episode, I'm going to be sharing one of the top ways to build your clinical confidence in the next 30 days. Now, before I jump into this plan, I did want to let you know that I am hosting a free webinar this week, and you can sign up at happypharmlife.com/confidence. I'm going to be talking about how to build your confidence as a new pharmacist. And if you aren't able to attend live, not to worry, I am going to give you the replay if you register at that same website, happypharmlife.com/confidence, and you're going to get the exact same information that I'm sharing in person in the replay I'm going to send you. With that, let's dive into how we're going to build your confidence in your clinical knowledge in the next 30 days. So if you've figured out that the area that you're deficient in is your clinical knowledge, the best way to improve your confidence in that area is to gain more clinical knowledge. Now, one of the mistakes people go into is they're like, okay, I need more clinical knowledge, and they just dive right in. There is no plan, there is no strategy to how they're going to build that clinical knowledge and what really is going to move the needle the most when it comes to their confidence. And so the first thing that you need to do is figure out your focus. Find one specific area that you can improve in the next 30 days and would move the needle the most in your job. So if you're somebody who works next to a pediatric clinic, for example, and you're not very familiar or comfortable with the medications that pediatric patients take, focusing in on pediatrics or even a specific disease state or types of disease states that pediatric patients encounter could be beneficial. For example, with cold and flu season coming up, you may want to look into common treatments for the flu. What do you do for pneumonia? What do you do for ear infections? What do you do for strep and upper respiratory tract infections? Things like that you're likely going to see a lot of in the coming months. Speaking of cold and flu season, if you're not comfortable with vaccinations and if that's coming up, you can focus in on learning your vaccination schedules well and the differences between the different formulations of flu vaccine. I think you get the picture here, just focusing in on an area that is really going to make the biggest difference if you learn that material. Now, if you're watching or listening to this and nothing just immediately comes to mind here, think about the most common disease states that your patients encounter and which one are you the least comfortable with. And you can even take a week or so and just see what moments do you feel the most uncomfortable, what information are you looking up the most, and use that as your starting point to figure out where exactly you want to focus. After you've picked a focus, the next thing you want to do is commit to learning something new every single day for the next 30 days. It doesn't have to be a ton of information. It could be something as small as trying to memorize one new drug fact or learn the mechanism of action for a new drug that is on the market. If you take the focus that I talked about earlier and you combine it with one new fact a day about that focus, I guarantee you will have more understanding about that disease state or focus at the end of 30 days, and you'll be able to talk to it more than you ever have before. Now, the process of gathering all this information can feel very daunting. 30 days is a long time. 30 days is a lot of information. Where are you going to get this information? How is it going to fit into your schedule that you're going to find the time to do this? Because I know you are a very busy pharmacist. There are a ton of things going on in the pharmacy every day. You have phone calls to answer, patients to counsel. If you're in a research setting like me, I have subjects with very complicated dispensations to prep and a lot of paperwork to do. So how do you fit in learning one new thing a day when you have such a busy schedule? You need to have a solid plan. If you actually want to commit to learning something new every single day for the next 30 days, you have to make a plan in order to make it happen. You need to schedule time in your day that is dedicated to learning this one new thing a day, but don't overcomplicate it. You can spend your time, say, standing in line while you're waiting for lunch to review a drug monograph on your phone on Lexicomp. Maybe you do some reading before work while you're drinking your coffee. Or maybe you have some time set aside, like the last 5 to 10 minutes of your shift, to review a newsletter that you're going to sign up for and have it come to your inbox so you can just review that before you head home. I know that most of us feel like we don't have a lot of empty space on our calendars or in our schedules, but oftentimes if we look at things that we're doing where we're just maybe scrolling on our phones or standing and waiting in line, we can find a few moments here or there that we can tuck in this information. For me, I have a 10-ish minute drive to work every day, which isn't bad, and then about a 15-minute walk into the hospital to my office because my parking garage is on the opposite side of the hospital. So actually my walk to my office is longer than my commute driving, which is a little bit interesting. During that time, that is a full 25 minutes that I can learn something. And so I am driving and walking, so I'm not going to be reading, but it's a great time to listen to an audiobook, or it's a good time to listen to a podcast where you can learn something new. There are a lot of clinical podcasts out there, so that could be an option. Some other things that I recommend if you're wanting to advance your clinical knowledge and continue to learn that you can incorporate into your routine in the next 30 days. And then hopefully many of these things will create a habit in those 30 days that you'll want to continue beyond that. But if we're focusing just on the next 30 days, here are some things you could do. You can join community listservs for the topic that you're most interested in. Some of these are paid. So like ACCP has different divisions, and you have to pay an additional fee to be like in the pediatrics one, which I am. But if that's not your specialty, like the example I gave earlier, where you're a retail pharmacist, you just happen to be next to a pediatric clinic, so you're getting a few more of those scripts, that probably isn't an option you want to go to. But you can find other organizations, ASHP, APHA, they have listservs that are free that you can join. They're engaged communities, and those communities can be a great place for you to go in, get signed up, and then get information back and just see what people are talking about, what questions they're having, and then you can also contribute. So if there's something you really want to learn and you're not finding information about it, these are experts in the area and they can likely help you. I'm a huge fan of staying up to date through newsletters, and so this could be a great way for you to learn more about a specific area. And this is exactly what I did for women's health. So when I started working at the Women's and Children's Hospital, I had worked there before as an intern, but we weren't really clinical-based interns. I was doing a lot of technician work. I did some projects and things like that, but I was not, verifying orders or anything like that. I wasn't a pharmacist yet. And so when it came time for me to staff there, I recognized that I had a deficiency in my knowledge in women's health because I'd been at a pediatric-only institution, and so I hadn't dealt with any women's health patients. So one of the things I did was sign up for a newsletter called the OBG Project, and that is ran by physicians. It's for physicians, and it sends new information about recent guideline changes or blog posts and summaries of these guidelines. So I was able to get up to date a lot quicker, and so I made it a priority of mine that each week that I was at work, because I was working 7 on 7 off, but each on week I would review the 2 articles, because they were doing weekly articles or weekly newsletters at the time. I would read those 2 newsletters at some point during the week and find what information in there was about medications, and I would review those topics. Another place you can get newsletters is from the FDA. They have many different newsletters about different disease states as well as different areas of pharmacy. So if you're looking more into just like keeping up to date, this is a good option because they'll send you alerts when a new medication comes out or drug shortages. I signed up for their women's health newsletter, and I think that comes out monthly. And that was another place that I was learning new information and what was most important to the FDA and new drugs that were released in the area of women's health. You can also sign up for newsletters for pharmacy organizations or population or disease state specific organizations. So when I was learning about spinal muscular atrophy, when I was in residency, I was doing a project and I knew that was coming up on Zolgensma, I signed up for the newsletter for Cure SMA. And while that was not a healthcare provider focused newsletter, it was giving me a lot of information about what was coming down the pipeline. So I could use that as a starting point and go further and learn more information somewhere else. Other places you can go is like Pharmacy Times, TLDR Pharmacy, Pharmacy Today and look at articles about new medications that are coming out and maybe the field you're wanting to focus in. So if you're wanting to focus in diabetes, look for their lectures or podcast episodes or blog posts or articles, whatever it may be, on the topic of diabetes, and read through one of those a day. Those are shorter than maybe reading a journal article, which is another option. I had a friend who stepped into a clinical specialist role. They'd done a PGY1, there was an opening, they went for it and they got it, and it was in an area that they were rather familiar with, but they didn't consider themselves a full expert in that. They were more jack of all trades when they stepped into that role. And so one of the things that this person did was they read a journal article a day, those key journal articles that got approval for a medication or the big randomized clinical trials in the last 5 years. And they dedicated themselves during their work week to read one of those a day. That is a huge ask. I understand that. But it worked, because by the end of that period of time, I think they did that for a couple of months, they felt much more confident in their clinical knowledge, and they then had a resource of reputable journal articles to back up recommendations that they were making when they were on rounds. Another place that you can go to learn new information is maybe a section of a guideline. It would be ridiculous to ask you to look at an entire guideline every single day for a month, but maybe reviewing a section of it that's relevant for pharmacy. And it may take you a week to review an entire guideline, but at least you've gotten through that guideline and you're going to feel more comfortable with making recommendations from that guideline in the future. Another slightly boring way to learn new information is to go to the drug monograph or read the package insert for maybe a new medication that's on the market. Again, this is not the most fun way to learn, but another thing that you can do, and one of the ways that I teach students about new medications, is I will go to the healthcare professional website for a new medication that's been approved. And because it's brand name, the sponsor for that, all the studies that happened and the manufacturer of that medication usually has videos about how the medication works. And so you can learn about the medication and the mechanism of action through those types of videos. And for visual or auditory learners, this is a great option instead of just trying to read through the package insert, not really understand how that mechanism of action works. Finding a video or something else that you can watch, that could be your one thing a day, is a 5-minute video that explains the mechanism of action of a medication that recently came onto the market. Another one that's not really super specific, you could go on Google to try to identify websites that have healthcare professional information. And once you do so, then you can commit to reading 1 or 2 of those articles a week. I hope you learned from this that growing your clinical knowledge does not have to be incredibly complicated. And if you are still struggling with confidence and you are wanting to dive deeper, you may find that your clinical knowledge isn't the only thing that's holding you back in the confidence space. So I hope you'll join me for the How to Build Your Confidence as a New Pharmacist webinar, and you can join me at happypharmlife.com/confidence to register. Thank you all for watching or listening, and until next time, keep on living your happy pharm life. Bye!